on Roosevelt Island in particular, Kohler needs to be maintained into the future. I have been there a few times, not as often as perhaps others, but I've been there for the CAB meetings, and I've met with Mr. Hughes, and he too is very respected as a professional and at Kohler. So without further ado, I also want to thank Isabel Abreu, who is our liaison from the Borough President's Office for board 11 and 8 community boards, and who takes all of constituent concerns and just the general concerns of New Yorkers very, very seriously. Just so the public knows, we have questions, but if you have questions in the Q&A, you are welcome to add them, and I will try to answer them. If we don't get to answer them, then we will make sure to get back to you, and I will assure you that in my office, we do get back to people and answer their questions. This is an incredibly important town hall. So without further ado, I want to really thank Assembly Member Rebecca Seawright, because it's through her that we drafted letters to health and hospitals, and it's her advocacy as well as others, but particularly her, who really, really stuck with the residents and never gave up in terms of the concerns that they brought to our attention. So Assembly Member, please go ahead. I know you're going to read a joint statement and from other elected officials, and please feel free to add whatever you want. Thank you.
Getting the right to vote. I call our borough president our modern day Eleanor Roosevelt. And it's honored to be with all of you this evening. Thank you for joining us for this important virtual hearing on the matter of the quality of care for patients and residents at Kohler Hospital. I, along with my colleagues representing Roosevelt Island, are here on behalf of the patients of whom I've received phone calls from and I've spoke to on the telephone, the residents and the advocates who were persistent in amplifying their concerns and complaints. We appreciate that HHC officials are here joining us this evening. Robert Hughes and his leadership, the CEO of Kohler Hospital, Michelle DeBacco, Vice President of Governmental Affairs and at HHC, and Bridget Ingraham, the Assistant Vice President of Governmental Affairs at HHC. They are here tonight not only to listen to the issues, but to respond with a plan of action. On behalf of the Attorney General's Office, they are aware of the complaints regarding the Kohler Hospital and Rehab Facility, and their Medicaid Fraud Control Unit continues to investigate allegations of abuse and neglect in the system. The Attorney General Tish James launched a hotline where residents, families, and members of the public can share their complaints about nursing homes. You can file a complaint by calling the Attorney General's office at 833-249-8499 or file a form online at ag.ny.gov/nursinghomes. Additionally, tonight we have a joint statement that I'll read on behalf of myself and our elected colleagues, Congresswoman Carolyn Maloney, Borough President Gail Brewer, Senator Jose Serrano, Assembly Health Chair Richard Gottfried, and Councilman Ben Kalos. This letter was written on June 25th. Dear Dr. Katz, President and Chief Executive Officer of HHC, we seek to take important new steps to ensure that NYC Health and Hospitals Kohler on Roosevelt Island is safe and supports community initiatives. The pandemic stretched Kohler's traditional role of providing long-term care to the poor to extreme limits, as we noted on our April 17th, 2020 letter to you at the height of the crisis. We sought clarity and data to bring transparency to numerous and sometimes conflicting accounts of conditions there. These included PPE availability, staffing, and safety of patients and nursing home residents as the new 350-bed facility opened to handle an overflow of what turned out to be new COVID-positive patients. We recognize that epidemiologists have continued to be struggling to understand the virus, its pathology, and methods of transmission, and that the Kohler building's mid-20th century construction preceded modern heating, ventilation, and air conditioning systems. Therefore, we ask that all residents of the nursing home portion of the building be tested once a week for COVID. To our knowledge, this testing did not occur. We believe that it is essential that the community leaders and stakeholders continue the conversation and exchange of information with you and your Kohler senior management team. Accordingly, we are constituting a community-based Kohler task force under the auspices of Community Board 8, chaired by Alita Camp, CB8's chair, and a professional mediator to be called upon when necessary. The task force will be composed of Kohler residents and families, local stakeholders, and elected officials. The task force will identify issues of concern and obtain timely responses from health and hospitals senior management, facilitate tours of Kohler for members of the committee and elected officials, and ensure healthcare workers or residents who speak out are shielded from any retribution. We ask that senior level officials from H&H be designated to work with the task force to ensure the highest communication and cooperation. Many of Kohler's patients and staff are people of color, and we are particularly concerned about any disparities in the care of treatment. We believe the task force will play a valuable role in working with health and hospitals to bring clarity to the operations at Kohler, especially in COVID testing and in the understanding of protocols. We believe the task force will move us forward toward our mutual goal of protecting patients, supporting staff, and resolving issues at Kohler. Sincerely, Congresswoman Carolyn B. Maloney, Borough President Gail Brewer, Senator Jose Serrano, Chairman of the Assembly Health Committee, Dick Gottfried, Rebecca Seawright, Assembly Member and Council Member Ben Kalos. Thank you.
Thank you very much, Assembly Member. I really appreciate that, and thank you for your phenomenal advocacy on this issue. Council Member Kalos is going to make an announcement.
I want to start with a huge thank you to our Borough President, Gail Brewer, to Rebecca Seawright for her amazing leadership, as well as our Health Committee Chair in the Assembly, Richard Gottfried. He's absolutely amazing. Glad to have him going back to Albany. I wanted to thank everyone, particularly the residents. As soon as the pandemic started, folks flagged the fact that the urgent care on the island had shut down and there wasn't access to the same type of medical care as other neighborhoods may appreciate. And so we've all been working with the Roosevelt Island Operating Corporation, health and hospitals to bring testing to Roosevelt Island, starting on Monday, June 29th at 11 a.m. and then Tuesday through Friday, July 3rd at 10 a.m. until 4 p.m. There will be free testing. It will be at the field adjacent to the Helix and Motorgate, and we hope everyone will go. There will be a van plus 2 10x10 tents. Residents will be met by a complement of registration clerk, operations manager, nurses, nurse practitioners, and patient navigators. Residents age 65 and over will be provided with a separate line. There is no RSVP, and care will be provided on a first-come, first-served basis. It is 11 a.m. on Monday, followed by 10 a.m. every other day until 3 p.m. Thank you, and thank you all for your partnership.
Thank you very much, Council Member. And I think I saw Assembly Member Godfrey join us. Assembly Member, do you want to say a few words?
You are unmuted, Assembly Member.
Excuse me?
You're unmuted, Assembly Member.
Okay. Assembly Member Godfrey, do you want to say a few words? So in the interim, why don't we go to Chair Alita Camp, who's going to read a statement from the community, from Community Board 8, and we could go back to the Assembly Member. Alita Camp.
Thank you. I'll be very brief. I want to thank all of
We can't hear you. Alita?
We cannot hear you.
Alita Camp, we cannot hear you at all. Do I go to another speaker?
Now you
Yeah,
can,
but
hear me, right?
Alita, yeah, you really have to start over again,
Okay,
Alita.
I will, and I apologize. I've had a hell of a day with my technology.
Okay, now we can hear you. So just start over. Go ahead.
I will. I want to thank all of our elected officials for working to ensure a much better quality of life for the residents at Kohler. CB8 supports our elected official statements. We call for greater attention to be paid to the residents' views, to their fears, concerns, and needs. The CB8 community includes the residents and staff at Kohler. We anticipate working with H&H to ensure that everyone at Kohler is treated with respect and dignity, and that the best possible care is given. We look forward to a collaborative and cooperative relationship with H&H for the well-being of Kohler residents. Thank you very much.
Thank you very much. I'm going to go back to if Assembly Member Dick Godfrey wants to say a few words, because I know you're on, but I don't know if you want to say a few words. Assembly Member? All right. Then I'm going to go to Vincent Pierce, who is a Kohler resident, and I want to thank him for his leadership because he's been on every single Zoom call, and he has really been the kind of leader in a very challenging circumstance that we all aspire to. So, Mr. Pierce, we look forward to hearing from you.
Hi, how you doing?
I'm fine. It's so good to see you.
Thank you. Same to you. I lived at Kohler since 2012. I've met some wonderful people, caring people who live and work here. I not only speak for myself, I speak for residents who cannot speak for themselves. And I would like to share a piece of creative writing that I published in May. It describes my experience at the time.
Yep.
It's called I Say No, We're Not Okay. A message to the higher powers. It says frustration is at an all-time high amongst Kohler residents during this coronavirus pandemic. Me especially. I'm a 34-year-old quadriplegic Black man. I am also a father, music producer, youth educator, and a gun violence survivor. They say everyone has a voice, but who can you really express your concerns to if someone in a higher power always denies them? For more than a month, I've been quarantined on a unit with residents who tested positive for COVID. And only now, after weeks of leaving the infected in bedrooms with the uninfected, are they starting to separate us. There is a shortage of PPE and a higher power denies it. Why nurses taking care of COVID patients, then turn around with the same gown on take care of a non-COVID patient? No communication between administration and residents at all. It likes no one cares how we feel. Now we share a space with Roosevelt Island Medical Center, RIMSI. The higher power said it was to house non-COVID patients to free up hospital space. But that changed on a dime. The higher power said RIMSI is used on an unused part of Kohler campus that has been abandoned for more than a decade. They were one floor above me. It is very possible that germs can travel through vents or linger in elevators. Sometimes I think we're being confined to our units to protect us from what they're actually bringing in. When asked about the death count in late April, a number of 6 was given by HAC's spin machine. But I can count 10 on my unit alone. As days go by, I ask myself how many more people have to get sick or die before someone higher than the higher power steps in and does what's right. And to end it, I just have a few questions.
Sure, go ahead. You can talk as long as you want, Mr. Pierce.
Like, why aren't our voices heard or respected when we do speak up? Why did it take a piece in the New York Post from traveling nurses for them to finally start separating people? And how will it be different if it is a second wave?
Right. Good question. Okay.
And
All
that's
right. I can't thank you enough. I've heard you on many discussions, and you're always incredibly articulate. It's very brave. And as the assembly member stated, there will be a task force, and I hope that you will join it and be the voice and, you know, be the leader that we need. And I also hope that our advocacy of keeping Kohler open in a way that you want is what we're aiming for. So thank you. And your children or your child should be very proud of you. So I just want to add that.
Thank you.
Mr. Hughes, I know you're going to speak for Health and Hospital as the director of Kohler, and we welcome you. Mr. Hughes?
Assemblymember Gottfried is actually unmuted.
Okay. Well, I asked Mr. Hughes to speak. If he's not going to go right now, then Assemblymember Godfrey, why don't you go ahead, and then we'll have Mr. Hughes.
Okay, thank you. Just a couple of opening thoughts, and then later on I'll have some particular questions. But
Good.
you know, the situation at Kohler is a concern to a lot of us. You know, we're getting very different messages as to what the conditions there are. One thing is very clear, and that is that nursing homes all across New York State for decades have been underfunded, understaffed, inadequately monitored by our state health department. And so the fact that when something like COVID-19 hits, a lot of longstanding problems become very much worse should not surprise anyone. And I think we need to have, I think the idea of a task force is enormously important. I think bringing more eyes and ears and voices into the picture is going to be important and helpful. I hope we can add to that task force some advocates like Mobilization for Justice or the Long-Term Care Community Council, people who are very experienced in dealing with nursing home quality issues. So I hope we can do that going forward, and I think we're going to get some good results from this. And I want to thank Gail and Rebecca Seawright, both of you, for the extraordinary work you've done on bringing us all together on this. Thanks.
Thank you very much, Assembly Member. And now I'm going to go back to Mr. Hughes, if you're there as Director of Kohler.
All right, thank you. And I am here. Can I be heard?
Very well.
Okay, thank you. And thank you, Borough President Brewer. And good evening, everyone. And I do want to thank you for the opportunity to update you on how Kohler has been faring during the COVID pandemic and how we are doing now. I do want to especially express the appreciation, for all of us, to the Roosevelt Island community and the elected officials for the support that they have shown throughout this and even before this to our residents and our staff. I know it's very reassuring to not only Mr. Pierce, but the many other residents that they have the support and advocacy of everyone. Clearly, there's a lot of passion for Kohler on behalf of Roosevelt Island and the elected officials. Although it's virtual, you can feel that passion coming through the screens, and I hear it loud and clear. I've been throughout this, I've had a number of communications with some community people, as well as the elected officials on some of these issues, as well as been in constant communication with the Community Advisory Board that we have here at Kohler, having had 9 virtual meetings with either the CAB leadership or the entire leadership over the last several months, keeping them informed of what has been transpiring here at Kohler. I think we can all acknowledge this has been an unprecedented event that has presented everyone with challenges, not only in our homes, personal lives, our communities, but in the healthcare system, nursing facilities, and to our residents and our staff. This, in my mind, has been especially difficult for our residents who experienced a significant change in their daily lives, not being able to move freely throughout the building and outside of the building, and facing the concerns that they were facing. I'm very tuned into that. I have spent my entire career working with the long-term care population. And for those of you who know of me, many of those many years have been spent here on Roosevelt Island between Goldwater and Kohler. So clearly this population, the most vulnerable, is my priority, and I build, my values are built around that. From the beginning of this pandemic, Kohler has sought to comply in every way with the federal CMS, CDC, and New York State Department of Health guidelines, especially in the beginning as it pertained to ensuring that our staff were wearing masks everywhere, were being checked for temperatures and symptoms when they arrived, had the appropriate PPE, plenty of supplies of the PPE, and cohorting our residents appropriately. And as those many guidelines from CDC and the state changed, which they seem to change every few days, it seemed, we kept pace with those as best we could. I think it's also important to mention that, being part of New York City Health and Hospitals, it was a great benefit for Kohler. We had access to a robust and secure supply chain of PPE, staffing, and other necessary supplies, and in addition to testing when testing was available. So that enabled us to go through this crisis, and we are still going through this, but being part of a system like Health and Hospitals was of great benefit for our residents and our staff. We did our best, although we had to limit visitations pursuant to the federal and state guidelines. We did our best to connect our residents with their families and their loved ones, providing them access to iPads for FaceTiming and Zoom calls and other forms of social media so that they could keep those connections going. Despite that, I think we all know that's no substitute for actual face-to-face visitations, and that's something that has been unfortunately missing from all of the nursing facilities. We have made good progress in this challenge, meeting this challenge with COVID-19. As I think mentioned maybe earlier, patients who are COVID positive or suspected of COVID are transferred to a specific unit and floor here at Kohler. It's dedicated for them. That enables us to bring them off of their units. We are testing our residents weekly. 100% of our residents are being tested weekly. We were one of the first facilities to be able to move in that direction, given that we had access to the ample supplies. So that is going well. And we are testing our staff pursuant to Governor Cuomo's executive order. We have been testing them since around mid-May, twice a week. And most recently, that is now once a week pursuant to the state guidelines. So that has been a tremendous benefit. Being able to test our residents once a week, regardless if they demonstrate symptoms, enables us to identify a resident who may be positive before symptoms start. That enables us to reduce the risk of spread as we transfer that resident to a COVID designated unit. So I do look forward throughout this session to answering questions and providing you with additional information. So thank you.
All right. Thank you very much. And I'm going to start with questions, but I want any of the panelists to feel free to jump in because you have more expertise than I do. Now, I know this is about PPE and staffing issues, and I do know Assemblymember Godfrey knows a lot more about the nursing home generally in the state than I do, but I can tell you it is an advantage to be part of health and hospitals. But I have to tell you that the nursing homes in general, when the pandemic was at its worst, we had some masks and gowns and we were giving them out as much as we could, but the nursing homes were begging. So, there's something wrong here. And I think it's still going on. So what I want to know is regarding PPE at Kohler during the critical period, there were conflicting statements on this issue of do or you do not have enough PPE. And so I just want to know, I just heard that there still might be a challenge, and I always listen to all voices. So what has Kohler done to establish that residents and workers will be adequately protected? And I guess I'm one of these people, like, even though CDC says X and the governor says Y and the mayor says A, I still want to do even more because I don't believe any of them. So I'm just wondering, what exactly are we doing about PPE now and in the future at Kohler?
Thank you. So from the outset, Kohler has had access to sufficient supplies of the right type of PPE for our staff. My take on the conflicting information that was out there came from some social media posts from some staff who were of the belief that they should have access to different PPE. This was not understanding that in particular N95s were only to be used in certain situations and not necessarily for all of the staff. They apparently were looking to have N95s when, according to the guidelines, they were not necessarily in need of the N95s. N95s to be used when in a nursing home setting when aerosol type treatment is being provided. Not all of our staff provide that treatment. So those staff who needed to have the N95s had it. So what really required us to do is to go back and re-educate our staff on several occasions to reinforce and reassure them that they were getting the appropriate PPE. As much as we reassured them, they still were looking for the higher level of PPE, although that was not necessarily necessary. But we do have ample supplies. These are supplies numbers that we are required to submit to the State Department of Health on a daily basis. We continue to have those ample supplies. We continue to have access to that supply chain. Going forward, we will continue to have that access, and we will continue to work with our staff.
So Mr. Pierce, to his credit, and maybe other residents also feel that there may not be enough right now, and you're saying there is. But you're next door to the largest, most well-endowed university, perhaps in the world, right? So I mean, just saying, sometimes you could ask for things that other nursing homes can't get because you're on Roosevelt Island. You can get more. So I'm just wondering, there is no need now for any additional, is what you're telling us at this moment.
Correct.
All right, because I'm just saying people may feel differently, and you should let us know because that is not a hard thing for us to get for Kohler. Like I said, I don't believe CDC, I don't believe the president, the governor, or the mayor. So we should have more and not just what you need. So I think that conversation should be ongoing. There were obviously during the pandemic, there was reports that there was a shortage in staffing, leaving permanent residents more susceptible to COVID. Is there a process in place to ensure that there are no staffing shortages? We're obviously concerned about current, and let's hope there's not a second wave. And are there mechanisms for regular inspections to evaluate needs and to ensure patient-oriented decision-making. The last part being perhaps the most important part of this question. So it's mostly, what about the staffing, and what about inspections, and what about patient input?
So yes, we do have adequate staffing, and we have had that throughout the pandemic. In the initial phases, when a number of staff were not able to come to work for various reasons, we were able to bring in extra staffing through staffing agencies. These were arrangements that New York City Health and Hospitals entered into. We were able to access many agency staff to come in and supplement our own staff who were not able to come in. Those relationships continue, those arrangements continue, and we continue to have access to those agency staff as needed now and going forward. So that's the process we have to ensure that there's adequate staffing. On an ongoing basis, we check the staffing. Our nursing leadership utilizes their staffing schedules, and they match up the number of nursing care hours needed for each unit based on the acuity level, and that's something that is looked at by them on a daily basis. We do have mechanisms in place for residents to be involved in decision making. We have, first of all, when it comes to the resident care, we have the comprehensive care planning meetings that involve the resident, and if appropriate, their designated representative or next of kin, and that gives the resident input into the development of the care plans. But on a day-to-day basis, the resident is included in the care decisions. We also have a resident council that is held here. Now, granted, during the pandemic, we were not able to, unfortunately, hold the resident council, but that's a forum normally well attended that residents have the opportunity to come and through the resident leadership voice any issues or concerns. I also hold monthly town hall meetings with the residents beyond the resident council meeting, and that provides another forum for the residents to come and freely speak about what their issues are, and also to hear updates from me. And throughout this pandemic, we were not able to hold those town hall meetings, due to the outbreak that existed. So we are getting back to those. The resident council leadership met with me, I believe it was yesterday. I think we have a town hall meeting set up for possibly next week, actually, and we will continue to build on that. We did we did have a process in place where our managers, administrators did visit the units on an ongoing basis throughout the last 3 months to, as best we could, communicate with the residents about what was taking place. And I understand completely that the residents being confined to their units, wanting to have answers and needing to know, why is this taking place? How long am I going to be here? When am I going to go out? When can we return to normalcy? And as much as we tried to communicate to them why this is happening, the need for it, it's really never, it's really never enough to the communication, and there's always more that we can do on that note. And that's something that, one of the lessons learned for me is that communication piece to our residents, more than what we were able to do.
Okay. I know, Dick Godfrey, you might want to ask about oversight, because I know you made some comments to that effect in the past, and you have lots of, put it mildly, experience with the State Department of Health. Do you want to ask anything or your questions? Assemblymember Gottfried? Louisa, can you unmute him?
Okay, I think I'm unmuted now.
We can
Okay.
hear you now, sir.
Okay, thanks. So I guess my questions about the health department would not really be for health and hospitals to answer. We'd have to have the state health department on the call. But you know, one of the things I've been concerned about is that the long-term care ombudsman program ordinarily would be visiting people in nursing homes. But you know, that hasn't happened since, I guess, I don't know, mid-March. I've been urging the health department to require every nursing home to frequently, not just once, but to frequently be communicating with residents and with family members about the existence of the ombudsman program and reminding them why they should be contacting the ombudsman and how to go about doing it. And you need to do that frequently because people need to be reminded, people forget, et cetera, et cetera. And that may be especially true for residents. So my first question would be, would Kohler begin such a program on a, I don't know, weekly, maybe more, maybe less basis, reminding every family member, every resident about how to contact the ombudsman program and why you might want to do that?
Yeah, I mean, that's a good point, especially during these last few months when the ombudsman was not able to be here on the regular basis that he had been. And that's something we can take a look at to see how we can build on that communication about the availability of the ombudsman to our residents. Many of our residents are very familiar with our ombudsman and do know how to get in touch with him as well as other avenues. But that's something that we can certainly look at.
Okay.
It's a suggestion.
And, you know, this is a question that you may not want to answer right now, but I would appreciate it if you would look into it. We frequently, in dealing with various entities, particularly government agencies, we find that if somebody is suing them about something, and certainly the state health department is always being sued about something, it is very convenient for government and often private entities to say, oh, we'd love to talk to you about X, Y, and Z, but oh, you know we can't talk to you because we're being sued. That has always struck me as an utterly bogus argument or claim to make. And I would hope that as we're dealing with issues about Kohler, that health and hospitals would not be raising that as an argument, because there may well be entities that will be bringing lawsuits over some of the things that they believe are going on or have gone on at Kohler.
Okay. All right. Thank you, Dick. Rebecca, did you want to pick up on anything so far? The Assembly member, Seawright? Louisa, can you unmute people?
Everyone should be able to unmute themselves, but Assembly Member Seawright is unmuted.
Okay. Assembly member, did you want to say anything about this?
No,
You're okay?
I'm good.
Okay. All right, so the next question is just about the concerns about the reporting of deaths in nursing homes. And obviously there was a New York Times story about it in terms of the numbers and the question. So we wanted to know in Kohler in particular, is the reporting of deaths correct between March 1st and June 20th? And do we know how many of them were COVID related? That's the first question. I don't know if you know what the numbers, it would be good to know to compare to what others have heard and how many of them were COVID related.
So the we were one of the most difficult, probably the most difficult aspect of this has been the impact on the nursing homes in the way of the loss of life. I think everyone has been touched by that. Kohler was affected by the COVID virus, and unfortunately there was a loss of life here at Kohler. That has been reported, and something that's very difficult for us as professionals, as leaders, clinicians, and especially so for our residents who lost fellow residents. The numbers that the Department of Health has been reporting publicly they report the number of deaths at the nursing facility. So the number of COVID positive residents who died at Kohler is 13. The number of residents who were suspected to have COVID who died at Kohler is 1.
Okay. And that's the entire, we're not over yet, God knows, but that's up to now.
These are the numbers up to now. These are the number of deaths that occurred at Kohler.
Okay. And the other question was, is it Kohler that determines health and hospitals the cause of death? Is that, like you said, I guess it's the Department of Health. In some cases, in other nursing homes, not necessarily here, I know, for instance, this happened a lot at Isabella. The patient was a patient at Isabella, and then they went to the hospital, and they died in the hospital. But that was considered somebody who was affiliated with Isabella. So the numbers you're giving me are individuals who either died at Kohler or at the hospital?
No, the numbers I gave you are the individuals who died at Kohler.
Kohler, okay.
There's a separate group of numbers for those residents who were transferred to the hospital and died in the hospital. Okay, so for that number, these are residents who went to the hospital. These are the COVID positive residents who went to the hospital and passed away. That number is 11.
Okay.
And COVID suspected who went to the hospital and passed away, that number is 1.
Okay, thank you. Because that's when the number goes up, unfortunately.
I just have a quick question, if I could.
Go ahead, Assembly Member.
Is there a memorial service that's being planned for the people that have passed?
We haven't scheduled a date, but one is going to be planned. Yes, that's being discussed now.
Okay, great.
Thank you.
Yes. Very necessary.
Absolutely. And I know there is regular testing now. When did the regular testing start for the residents? And
we had 100% of our residents tested by the end of May, first week of June. Okay. And then that's when the weekly testing began. But we embarked on a very aggressive testing strategy in the mid-May time period, I guess, to test everyone regardless of whether they were symptomatic or not. So it was very important to test all of our residents to identify anybody who was positive before they became symptomatic, and that would give us time to quarantine them away from the other residents and prevent the spread.
Well, that's the issue. That was the one that hit the press, was that there were many reports from residents and from advocates that there was not enough isolation of COVID patients. We all read in the papers, and you even got some national publicity that wasn't helpful, that patients COVID positive were placed in the same room as those with no symptoms. And we know that there was a COVID unit established in mid-May. So I just was wondering if you could comment on all of that. And then I know that I assume there are isolation procedures now, but you know, if it's true, why the past, and what are the isolation and quarantine practices going forward? Because we all have to deal with what's going forward.
So from the beginning, we were following the the federal and state guidelines regarding quarantining of the residents, so that those residents that were positive were quarantined either in their own room by themselves or with another COVID positive resident. If a resident was suspected of having COVID, then they too were quarantined either by themselves in their own room or with another resident who was suspected of having COVID. So that's how the quarantining was happening. We initially were doing it on the units that those residents were on and quarantining them within those cohorts in their rooms, although on their units. We eventually evolved to the point where we created these dedicated COVID units that we began transferring them to. So we were following the guidelines, we were in compliance, quarantining them, positives with positives and suspected with suspected, even though it was on different units. And we have, as I said, came up with a best practice to have a dedicated area for those residents to go to. And that's the process we have been following since mid-May. We continue to follow that process when necessary, although thankfully it is less and less necessary. And that is part of our plan going forward and part of our policy processes going forward.
Okay, because I know there was a lot of discussion during the worst of it that was not what was happening. And I know you showed me, in one virtual how, people were entering in different locations and the testing that was going on in terms of a visual, which I appreciate. But the nurses, people are afraid to come forward. Mr. Hughes, when I say that to Dr. Katz, for whom I have great respect, he says, I don't have any retaliation bone in my body. And I actually believe him, but people do feel that. So I'm just letting you know that the staff is afraid to say anything, but they do feel that what you stated, that there was more mixing, shall we say, than what you stated. So maybe you were following CDC, but I guess it's hard to know who has and who doesn't, because we all are often we have no symptoms, asymptomatic. So I don't know how you would, I just wish that we had maybe not enough space or not enough guidelines to be able to keep the residents very separate from those who were coming from other locations who had COVID. I guess you just didn't have the space to do that. Was that the situation?
We have a very good process now. The space became available to us, and we took advantage of it at that time. It was this pandemic, and as it moved through not only the communities but moved through the nursing facilities, it would evolve from really day to day, and every couple of days, you saw something different. And guidelines that made sense one day, a new set of guidelines would come out several days later, which shifted the direction that you would go in. And decisions that you made on one day and best decisions that you made on one day, you needed to change a couple of days later because of how the virus was moving. And I think that's what we saw really throughout science, throughout the healthcare industry, and throughout our communities. And the nursing facilities were not immune from that.
Challenging. The other thing was just in terms of your great staff, and people do love your staff. That's very also universal, but they are a little afraid to come and speak because of the way in which agencies in general operates, not special to health and hospitals. But were there healthcare workers who were diagnosed with COVID and passed away, or were you not, thank God, having to deal with that?
We had our staff, unfortunately, who came down with COVID, tested COVID positive. I believe there was one staff member who passed away.
Okay. All right. And the other question I have was, what is the N95 need now? Is that something that's ongoing for staff? I know there's enough PPE now because it's not such a crisis, but is that something that is still following the guidelines of only certain situations need the N95? Is that an ongoing situation?
Those guidelines are still in place. We have sufficient supplies of N95. We have opted on the unit that we have for COVID positive patients. We have opted to have all of the staff wear N95s on those units due to the concentration of COVID patients there. So, we are at that point. with the use of the N95s.
So even non-medical staff can have an N95 now if it's needed.
If they're working on that unit, yes.
I wish we'd had that from the very beginning, because it would have saved an awful lot of lives.
May I ask a question?
Sure, go ahead, Alita, sorry.
Thank you. No, that's okay. There's been quite a lot of inconsistent information from the residents and the staff and you, sir. The residents are concerned about more than just not going out, about the items that Borough President Brewer brought up, such as the deaths, people who left Kohler and didn't come back, not knowing why people died or how many died or the causes, the mixing of or what they allege is the mixing of COVID and non-COVID patients. And so while, and I'm advocating for the community right now, so forgive me for sounding like this unless conciliatory. I'm a mediator normally. So how can we look at the future when you paint a picture that's as rosy as could possibly be under more than challenging circumstances, but yet I don't understand why the residents and the staff would be making up the things that they're saying. So there's an enormous gap between the situation as you tell it and the situation as they tell it, and moving forward into the future and planning in case there's a second or a third wave requires a trust. And I'm just having a little trouble with this, which I think is why we're talking about forming the task force. So I just don't understand why there is so much inconsistency and how we could move forward when there is not an acknowledgement of some of these issues that have gone wrong in the past. Thank you very much, Madam Borough President.
I want, Mr. Hughes, you want to answer some of those? So those are good questions because
No, yeah, I mean, those are very valid questions. Looking at it from any point of view, you know, I would imagine. Now, you know, as I talked about the PPE issue, you know, there has been sufficient supplies of PPE for our staff. There was the thought on the part of many staff that they should be having the N95s, even though that was not pursuant to guidelines. So right there, you know, a narrative begins that they don't have the right PPE equipment, and then that narrative, you know, grows and becomes public, and it's shared with the residents. You know, at the same time, the residents are observing what's going on. They have some information. They don't have all of the information. They're confined to their units. They're not receiving information, timely information, and that, you know, creates uncertainty, lack of clarity, and, you know, just, you know, bad information. I don't mean to paint a rosy picture. This was not, it was anything but here for you know, 3 months, as it was in any nursing facility. The staff and the leadership here worked extremely hard under very, very difficult circumstances. It seemed like 90 days was one long day. Yeah. For all of us. The level of concern for our residents was at the highest levels. And I can only imagine, as bad as it was for us, how it was for our residents. Being on those units, not having the access to information, and you know, hearing concerns, seeing observing what they think are concerns. You know, again, one of the lessons learned I had from all of this is that as occupied as we were in, you know, just dealing with the day-to-day and trying to make it as safe as possible for our residents, you know, and to limit the spread, that the communication aspect to our residents and even to our staff for that matter was something that needs to be improved upon. It really needs to be improved upon.
I think communication. Could you have? Go ahead, somebody.
Yes, it's yes. When
Mr.
you
Pierce,
say,
go ahead. Yes.
Yes, when you say we're getting the wrong information, how could you say we're getting the wrong information when we're living this? We're seeing this. We're seeing people in rooms that's with people that's not, that wind up getting symptoms for months before y'all start doing anything. We see that the nurses don't have enough PPE to change from room to room. Like, how can you say we're getting the bad information when we're locked down? We're not seeing nobody else. Like, this is something that we're living through. Like, how could you say we're getting the bad information?
Mr. Hughes?
I respect what what the residents have said, what they are saying, and when we do get together and we talk about it, we'll look at it even more closely. So
let me ask you about current, and I'd love others to jump in, but I got 3 current questions because I know time is of the essence. So what's the story? I know you mentioned this at the beginning, but what's the story with visitors now? Because I know each edict from the governor is different, and I know it changes. And then right now, are staff changing between COVID and non-COVID in terms of PPE? That's still a concern for people, and it was brought up earlier by Mr. Pierce. And then in terms of people leaving and going outside, because of course we all know that the individuals who are, fresh air is a good disinfectant. So I'm just wondering those 3 questions.
So yes, thank you. So as far as the visitors go, there still is the State Department of Health restriction on visitors into the nursing facility, unfortunately.
Yep.
Now that the units are not on quarantine, residents are able to move throughout the facility, to move around throughout the facility. And we do have a nice fenced-in large courtyard, which residents are able to go out to for several hours a day. So that we're providing that fresh air for them.
Okay, and there's some reason why they can't go out with proper masking and so on? Is that something still to be decided?
When you're referring to going out into the community?
Absolutely, yes.
Okay, so we still want to, and I think we're still required to take precautions to limit the residents going into the community because there still is community spread. It goes along with limiting the visitor access. So we're asking our residents, and I know a number of them like to go into the Roosevelt Island community and some like going into Queens and Manhattan. We're asking them to not do that for now, and they've been very respectful of that.
Okay, all right. I'm just saying because we love seeing them, so it's a two-way street.
I know.
We love seeing them. I know time is of the essence. So the issue is, how is Kohler addressing the mental health of patients, but probably also staff who have been traumatized by all this? I'm sure that you're working on that.
So yes, we are fortunate at Kohler. We're one of the few nursing homes, I think, around that has a behavioral health service. We have psychiatrists and psychologists on staff. They're not through a vendor. They're actually work for us. They're employed by us. So with that service, along with our social work department and our recreation department, they worked very well throughout the pandemic, the last several months, working with residents on the unit during this difficult time, this trying time, helping them through that. It would have been nice to have 10 times as many of those behavioral health staff as we did have, but we were able to address that concern to the extent that we were able to through that. We are continuing that with our residents, and I know it's a significant need that they have. There is going to be trauma coming through this, coming after it, and we need to be prepared to deal with that. As far as our staff goes, again, I must sing the praises of Health and Hospitals taking the leadership on this with their program, Helping Heal is Heal, and encouraging the facilities to establish wellness rooms, to put into place programs for the staff throughout this time period, and through the many donations that came from philanthropic groups and local community organizations, we were able to bring food in for our staff on a pretty regular basis, donations for them, and also having these group therapy type sessions that we will continue to have.
Okay. So I know we have to wrap up, but there's just a couple of things. I think you're going to improve the communication, and we will work with you, because even though there was a real challenge during the worst of the pandemic, I hope that we can work together to rebuild the trust, because I think that's what you're looking to do. And I think there were some 2010 written policies covering the rights of residents will maybe need to be updated. So is that something that you know about? Because I don't, and that's something that can be done?
I believe that this is referring to the residents' rights information that is out there. And
yes.
This is the most current information that's available through DOH, the resident rights list. We have a strong resident rights program here at Kohler. That program includes training, education, not only of our staff, but of our residents on what their rights are and who they can contact when they feel their rights have been violated. This program, we are required to train our staff on every year. And the Department of Health, when they conduct their surveys, they review our resident rights program to make sure it is in compliance with their regulations, which are pretty robust. So that the 2010 is the most recent information of
it might need to be updated, not by you necessarily, but by the collective group. That's what I'm saying.
Agreed.
2010 was a long time ago, with 10 years ago. All right, so I know that we need to, we promised 7 o'clock, and I know my questions have been hard, but I want you, the bad news is the residents are beloved, and the good news is Kohler is beloved. So we all need to work together to try to make it the absolute best that it possibly can be. And I hope that you have enough PPE. If not, quietly or overtly let us know, because we will take care of that. Sometimes you have to be quiet and tell people things and not just be, be open about it, because people just love Kohler. I mean, you're working in an environment that is so special, as you know, because I know people have a lot of respect for you and for the staff, but also for the residents. So I hope that the separation is real. We hope that there's enough, PPE changing, there's enough N95s, and that we can work together either through the task force, the CAB, or any other opportunities to be able to make the residents have the best opportunity they can, and the staff and Kohler in general. And I'll be absolutely sure that Kohler is going to be there for a very long time. That's also my long-term goal. So thank you very much. Assembly Member Seawright, do you want to add anything?
No, thank you very much. There's a number of questions that have come into my office, and so we'll be in touch with Mr. Hughes. I think just improved communication. I was on Roosevelt Island last week and drove around Kohler Hospital. I was looking to see if the 2 refrigerated trucks in the back parking lot were still there, and it looked like they weren't. But we've just been asking so many of these questions that I think going forward, just a total improvement on communication to elected officials and to the community and to the residents, the patients, everybody, all the stakeholders. So thank you.
Okay, thank you very much. Thank you, Mr. Pierce. Thank you, all the elected officials. Thank you, Community Board 8. We do have quite a few questions that we were not able to get to in the chat, but I promise, working with the Assembly member, adding to your list and this list, we will get them all answered, and we look forward to a very productive discussion. Thank you very much, everybody. Good night.
Thank you.
Good night. Thank you.